Hello, everyone. Welcome, sons. We're so excited to have you here. That's an overused word I've heard from my son when he hears me at home on these webinars, but I am. And so welcome. We want you to have the best experience today. So please make sure you're connected to your computer is to a power outlet. Close any unnecessary windows on your browser. Utilize headphones, mute your microphone, and turn on your video. We want to see you. We have some great guests today, so we want to meet and greet you guys and ask questions in the chat at any time. We will respond. We have our Sun mentors monitoring the chat, so if you have a question, feel free to put it in the chat. Why don't you let us know? As usual, we always start with tell us you're here, where you're from. We want to know who's with us today. And this is an interactive session. So really, if you don't know how to use the chat, there's a button that says chat. You click on that and you make sure it is addressed to everyone. So that way everybody can see the questions. Okay. There's good morning, Jay from Mammoth Hospital. Welcome. Hey, Christian from Highland. Okay, we got Doctors Medical Center, Modesto, Hanford, Adventist Hanford. Welcome, Elvia. Marla from Santa Rosa. Ronnie from San Juan. Azzy from South Lake Tahoe. Good morning from LA, USC. Woo-hoo. I'm from Southern California, so nice to see. Araceli, hello, welcome. Wow, we've got a full house. People just keep coming. So we're great. We're going to get started. We have an action-packed agenda today. So welcome to the Sun Regional Meeting. This is all about collaboration and networking. And of course, it's brought to you by California Bridge. Today's training agenda, we're going to start with inspiration. And you guys, we are so honored to have two of our regional directors to give us some inspiration today. So we're really excited for that. We have our guest speaker from National Harm Reduction Coalition. He was with us last time, so I'll introduce him later. You guys know him. And then we're going to have a breakout activity so you can have some networking. So today's objectives, just for our CEU credits, is describe strategies to enhance and support cultural considerations, and also identify techniques to engage in cultural sensitivity communication. So again, we have an action-packed agenda, and our inspiration is from Dr. Raul Ayala. He is the ambulatory medical officer for Adventist Health West, located in California, Oregon, Washington, and Hawaii. He's a very busy guy. He leads clinical integration through 280 community clinics and collaboration of the continuum of care with 22 hospitals. His team started a journey to incorporate social determinants of health by screening and providing services with every clinic visit in food insecurity, home insecurity, and transportation insecurity. And this is really important to the work we do. And this just really blew my mind, Dr. Ayala. One innovative project he's working on is creating virtual care for the homeless. During this COVID time, virtual care was expanded across all clinics. And as a result, Dr. Ayala and his team collaborated with nonprofit organizations to start providing virtual care for homeless camps in Selma and Sanger, California. Dr. Ayala attended UCSF for graduate medical studies and is board certified in family medicine and community medicine, and completed a master's degree in healthcare management from Harvard School of Public Health. So again, you're just doing some great innovative things, Dr. Ayala, and welcome.
Thank you. Thank you so much. That was a mouthful, but I appreciate your kind words. For me, it's a privilege to be here with everybody. It's something that I've become a fan of with, the start of just everything having to do with Bridge and just the collaborative effort that we've had with not only our communities, hospital, clinics, but other colleagues and all of you that we continue to work on. I think one of the important things that I'll just start off with is a big a big, humongous thank you to all of you that are out there doing this work, because it takes everybody and it takes a big community to do what we do. And everybody was chosen to do this work. And a lot of it is just, personal, of why you do what you do. And one of the important things that I wanted to talk about as a part of our journey, and how do we think about the things that we do every day, and as a substance use navigator, or a physician, nurse, caretaker, etc. What is my role in that, and how do I get how do I become more involved, and how does my culture become part of that ongoing experience for those patients that come in through our doors. And so I wanted to just touch a little bit on some of the important work that has already happened, and really a thought process that is near and dear to me, and that I wanted to share. And maybe at some point, Sherry, I'd like to send folks some maybe preliminary articles or text on what is now being known as the patient-centered, or design, patient design, or human design, and design thinking. And so a lot of what you'll hear, the mecca of this study, of this background, is from Stanford University, but it's being used in parts of the world. And I more closely was related to it at the work that we did in the East Coast. And so I wanted to share a little bit about that, because that's a lot of the work that we do now. And really it's looking at, the fundamentals of this design thinking is looking at the human centeredness to what we do, and looking at things and sort of reframing how we were providing care, and looking at it from, in this case, the patient. And not only is it a patient, but it's also a person, and a person that is in need. And I think that, reframing that piece to where we recalibrate how we initiate, how we conversate, the words that we use, the tones that we use, the gestures that we use, is all part of this design of the humanness. And I think a lot of us do that every day. And I think that the future is more intentional into providing this type of study, and really a working frame around what we do in healthcare. And so we all are in the healthcare field here. And there are many of us that are more maybe at a closer level, but we're all part of this design of the humanness. And I think that's part of what we want to do, is that, we identify, but it's basically, it's more on what do we bring to that design, and, where are we coming from that will allow us to see that patient in the ER or the clinic or the street or wherever it is that we're providing services. And how do we involve others to have that same human perspective, that it is a person in need, and we need to think about those things. But first and foremost, we think about it from our own perspective. And how do we start to redesign and reframe how we were tackling a certain subject, but now we're looking at it from this is not me, this is that person that I want to save or I want to help. But how do I do that, but not from what I think, but more on what does the patient need? How would the patient want to receive that care? How would that patient want to feel that they're being cared for? And I think a lot of that is happening through the substance use navigator work, right? So a lot of these things you're learning about the patient, you don't know the patient, you want to help the patient, but how is it that we design not only the work that we do, but others around us to start thinking in that frame to say, I am just here to help you. How would you like to be helped? And I think when we start to think about those things, we tend to start making steps in that direction that others start to say, wait a minute, that's a nice way of saying that, or that's a nice way of doing that. It's the same thing, but you're redesigning it to a humanistic, more of the human approach, and saying you can have it your way in a place that maybe we weren't we would not think of it that way, because it's maybe too much, or it's maybe too little, or the patients are not there for that. But I think that it's a framework. And, if we can do a couple of things by just saying, number one, what do I bring today? How am I showing up today? I mean, that's number one, right? Because a lot of it is your self-awareness. And the next thing is thinking about, as you interview that person, the patient, or you ask questions, being more intuitive about the things that they're answering. And maybe sometimes just number two is a little bit of pause to say, tell me more. Tell me more about what you're saying right now. Because a lot of the times what we do is we just go through checklists or things that we're supposed to do because it's part of that protocol. But I think that the humanistic part and the design thinking is saying, please tell me more. I am here for you. Please tell me more. I'm here to help. So those are the two things that I would, just say at the top of my head here about all the work that you do, which is pretty incredible, because I think each and every one of you are gifted to do what you're doing right now. And I think that we can start to really think about the humanistic design of providing care. And so with that said, Sherry and all, I'm thankful of the opportunity to conceptualize something that is a whole study, but it's really about the awareness of what do I bring today, this morning, and how can I help you, but the way that you want to be helped. So thank you for the opportunity. Always grateful.
Thank you, Dr. Ayala. And can you forward me an email that study, and I will send it with our evaluation and our follow-up. That was great. And I love the fact that you told them they are role models. They are role models in our ED. So that is some great words. Thank you so much. I really appreciate that. Thank you. Next, we have Dr. Jennifer Zahn, Regional Director. Jennifer is an emergency medicine physician in Los Angeles at the California Hospital Medical Center, as well as the Southern California Permanente Medical Group, and a Regional Director. Welcome, Dr. Zahn.
Hey, thank you. It's so good to see all of you on here. I'm going to be quick. I just wanted to share an article in the New York Times I was reading recently about how overdose deaths have increased during the pandemic. And since this session is about cultural differences and inequities, I wanted to share some information I found from this article. So this article highlighted that 87,000 people died of drug overdose during the last 12 months, which is higher than any other 12-month period in the past. And the biggest peak of this was during April and May of 2020, right when the pandemic started, everything closed down and people were social distancing and isolating. A lot of these deaths were due to fentanyl and synthetic opioids, and then methamphetamines played a huge role as well. There was a survey from the Johns Hopkins School of Public Health conducted of substance users in 11 states, and the survey found that during the pandemic, people used substances more often. They used them alone more often, and about half of the users said that the drugs were cut or mixed. What was really shocking to me was that the highest mortality from opioids is in Black Americans and during this 12-month period. And then the highest mortality from methamphetamine overdose was in American Indians and Alaskan Natives. So it just goes to show that there are a lot of racial inequities in treatment, in incarceration, and just in substance use and mortality overall. I saw that the White House released a drug policy priority statement April 1st, and I'll go ahead and share that as well. And these policies align so much with what you guys are doing and what California Bridge aims to do. And if you look at the 7 policy priorities, number 2 is advancing racial equity issues in our approach to drug policy. Yeah, Susan, I'm so sorry to hear that. So this impacts all of us, and luckily we have an administration that is supporting the work that we do. Biden is putting $1.5 billion toward prevention and treatment of SUD this year, $30 million for funding local services like needle exchange, harm reduction services, and he announced that federal funding can be used to buy fentanyl test strips. So, these are small steps, but very important ones toward advancing racial equity in treatment and expanding access to treatment in general. So you guys are the centerpiece of the California Bridge program. You are the ones in the front line doing this work. And just wanted to show you guys how important it is. So thank you.
Wow, thank you for sharing this. These are some great articles, you guys, and our regional directors, our docs really were excited to come and share with you. So again, thank you for your time and sharing this really valuable information. We really appreciate it, Dr. Zahn. Okay, next up, we are going to do a quick breakout. This is basically what we're going to do is if you were sitting down at your table, we want to take a moment for you to meet somebody. So this is kind of the icebreaker at your table. So what we're going to do is it's random. We don't know who's going to be in your room. This is totally just, networking and making sure. Caroline, are we good to go?
Yep, I'm going to open the breakout rooms now.
Okay, so just
Hey, Joe, we're doing breakout rooms for introduction, so I'm going to move you into a breakout room, okay?
Okay, thanks.
Hey, Devika, everyone's in breakout rooms, but they're about to come back to the main session, okay?
Yeah, no worries.
Hello?
Hello, is everybody back? All right. Okay, I think everybody is back. Do I get the thumbs up
Yep.
from everybody? Okay, we're
Yep,
moving.
everybody is back.
Okay, before I introduce Charles, I think you guys already know him. We quickly want to debut, just take a minute. We are going to show you our new Sun landing page. It's going to quickly come up. This is hot off the press. Our comms team, Caroline specifically, made this a one place on our website, California Bridge. Tells you everything you need to know. There is a video about with Rebecca, one of our Sun mentors, a short video. It tells you the 3 things you need if you're a new Sun, or just a refresher for existing Suns. It gives the Sun training session. It has registration as well as past training. If you missed one of this series, you can click on and it'll take you to the recorded session. There's the eval for CEU credit. And again, there's all of our Sun mentors. If you're not sure about Sun mentor, you can reach out Sun at California Bridge. So again, it has a great resource with everything one stop here. Substance use navigation toolkit if you haven't received that yet, and just some patient testimonials, some inspiration from our Sun mentors. So again, this is our Sun landing page. So wanted to quickly introduce that. Next up is one of our favorite speakers, Charles Hawthorne. They are the capacity building manager for the National Harm Reduction Coalition. If you were here with us 2 months ago in February, he was here. Their role includes leading the National Harm Reduction Coalition's harm reduction training work for the state of California, as well as supporting harm reduction programs with technical assistance. Charles received their BS in biochemistry from Purdue University and is currently pursuing their master's in public health from Johns Hopkins University as a Bloomberg American Health Initiative Fellow. And that always impresses me when I read that, Charles. I know how hard you work on that. So definitely, without further introduction, Charles Hawthorne.
Thank you so much. Really quick, how much time do I have, Sherry, just to make sure?
To be sure, we have you until, let's see, we can make adjustments. So I'm going to say 25 minutes.
Let's do it. All right.
Okay.
All right, so let's go ahead and get started. So I think what we're going to be talking about today is cultural humility and how that kind of relates to our harm reduction work. And specifically, how are we moving as Suns and how are we moving as support networks for people who use drugs within our hospitals? So when you think about it, what are some ways that the culture of patients in your hospital, specifically patients that you're working with, how might their culture be different than your own? What are some examples and that they might be different? Just across the spectrum. You can just drop them into the group chat or unmute and talk. Language. So what language they speak? Do they speak a different language than you, maybe a different dialect? Tambra had said homeless. So maybe I think when we even talk about a culture of homelessness and the culture of being unhoused, culture is such a micro-faceted thing. It's really different. And so somebody might experience the world, people experience the world differently when they are unhoused versus when they're housed. Family bonds, attendance, family support and family dynamics, those are all huge. So how people connect with their family and their support network. Economic differences, yes, so income, how that impacts how you see the world. People who have a lot of money and a lot of resources interact culturally within a hospital space than people who do not, for a variety of reasons, including like insurance coverage. How scared are you that you're gonna have to pay for this? How has the medical system historically treated you? Ethnicity, race, religion, that just covers a whole spectrum right there of how people show up differently based on where they're from, what they look like, what they believe. Those are huge pieces. Education. What do you know? Where, and not even just like the knowledge that you hold, but what systems have you been educated in? Have you been educated just kind of through life, through working, through doing just kind of living, or did you go to like a college or a higher education institution? And so when you go to those places, you see the world differently. It changes how you interact with decision making. It changes how you interact with professionals. Sense of time. I think that's a really good one, Serena. So people see time differently. Some people see time as a suggestion. It's like you say 11 o'clock, it's like, it'd be great if you could get there by 11. It's like, for some people, you say 11 o'clock, it means do not show up before 11. Versus some of us, it might be 11 o'clock, you need to be there at 10:45. So the way that people see time and the way that they see a deadline might be different. Gender and gender identity, for sure, Cole, the way people might see their own gender, the way they might interact with their community. So we are connecting primarily through email now, and many work remote, which might be challenging. So some people might be a lot more comfortable moving on the internet and talking via Zoom, which is something that I'm really used to based on jobs and roles that I've had before. But if that's not something you've had, it's a really challenge. It can be a challenge to change that. So when we talk about like workplace culture, that's a big thing as well. So a lot of people have not had experiences of connecting over the internet. They're used to handling conflict and issues very directly within their community face to face. And so if that's not happening, it can be a challenge. Stigma. So the ways that different things are stigmatized: is sex stigmatized, is drug use stigmatized, what type of drug use and in what context, their belief system, their age, all of those things definitely impact it. Maybe abstinence-based recovery versus harm reduction. And so when we talk about maybe abstinence, maybe saying like abstinence only, saying abstinence is the only way, versus harm reduction, which might recognize that there's a spectrum of strategies that people can use to navigate their substance use. And so there might be a difference in the ways that those communities see an issue like buprenorphine prescription in the emergency room. It might be a difference in the way those communities think about something like relapse or resuming use. And all of those things can really impact how we engage with them. And I love the fact that we've seen all of these different examples, because the truth is we all have a very unique interaction with culture. As a Black queer person, I have a culture in the ways that I interact with my family and in Black community. I have other ways that I interact with my queer community. I have other ways I interact within a social setting like my school or my job. And so we're all kind of navigating and balancing these at all different places. And so it's important to hold that people's culture is probably going to be different than ours. It is probably going to change. And oftentimes the assumption that we make that people's culture is the same of ours is really rooted in those systems of like white supremacy and patriarchy, saying we're all the same, we're all gonna have the same conversation. Because when we operate from those perspectives, it invisibilizes a lot of other people. It says, don't worry about that, we all have to kind of do it my way. And oftentimes that just doesn't create a lot of room for people who are not the standard group. Could you hit next slide, please? Thank you. So when we talk about reimagining responding to difference, a lot of times when we think about difference is really hard. People don't know how to deal with difference. Serena, I think that was just such a great example when you talked about time, because I think that's just the root of so much conflict that I've seen in situations like hospitals and syringe access programs and stuff like that. Because a lot of the times when we think about difference, we think about that's a problem. I'm trying to do things my way. I'm trying to get stuff done. And y'all are stopping me from getting it done because you're moving in a way that is not how I think we need to be moving. And that can create a lot of challenges. And what happens is when we don't reimagine how we respond to that, it's a really big challenge to create cultural safety. And we need cultural safety, because cultural safety is how people are able to continue showing up. Cultural safety is what ensures that people trust us, that they know that we're hearing them, that we know that that they know that we have their best interest at heart. And so we're trying to foster that. All right, next slide. So when we talk about cultural safety, on one end, we might have something like cultural awareness and sensitivity. So so my mother is a diversity and inclusion director at this big organization, at this big company. And so 20 years ago, when she was starting in her role, she was doing cultural sensitivity or cultural awareness trainings. That is basically saying, please don't get us sued. Please don't have somebody coming in here and suing us because you are using inappropriate language. You're calling them a stigmatizing term. Don't do that. So maybe when we talk about cultural awareness and sensitivity, we might talk about some words. We might say, maybe don't call people the N-word. Maybe don't call people junkies. Maybe you shouldn't call that person a hooker. Just to start. And while not comprehensive, it is a start. And like when we started doing a lot of these cultural conversations a long time ago, that's kind of where a lot of people stopped. They were like, you just need to be aware that people are different from you, and you need to be sensitive to that. And that's kind of on the low end of cultural safety, because if you think about people who they might know you're different, but if that doesn't actually change the way that we engage with people, that's not actually creating cultural safety. All right, and then next slide. And then we kind of moved along this spectrum. And then we started doing these cultural competency trainings. That's when we started having a lot more of these, like, bring in all of your different food, teach us about your culture. That's when we start talking about terms like this group of people tends to be late, and that's just the fact. So you just got to deal with it. Maybe we're talking about this is how this group of people as a whole feels about this thing. What we recognize within cultural competency is two things. Number one, cultures are not a monolith. Everybody who is part of a culture does not see things the same way. So the idea that we can be competent in a culture implies that there is a specific culture to know and understand. On top of that, if we do not come from a culture, we are never truly going to be competent in what it is. And it's not like you're learning how to like do a blood draw, or you're learning what mitosis is. It's not very concrete. Like you learn these 6 steps and then you're done. It's deep, it's faceted, it's different, and it's constantly changing. So cultural competency is a term that can be really challenging to create cultural safety, because even though it might put us in a space that we know, like, hey, this person wears a burqa, or this person wears different types of religious garments in order to, and I know that, and I know that's okay, and that's good. And if that still doesn't change my behavior, then we're still really not creating that cultural safety. All right, and then next slide. So where we've kind of landed on this at this point, and you know what, maybe in 10 years, I'll be adding another slide to this talking about the next thing. But right now, where we're kind of sitting at is this concept of cultural humility. And so when we talked about cultural humility kind of takes these concepts a little further and says instead, we are people who have our own experiences with culture. We understand our own experiences. We can try to understand other people's, but ultimately, in order to actually support people, we have to have a certain level of humility. We have to be able to hold that we're not always going to know what's going on with people. And we have to create room to ask questions, to be wrong, to learn, to grow, to figure out different ways to engage with people. And more than anything else, we have to change our behavior in order to engage with that. And when we are able to hear people when they give us feedback, when we're able to create space for feedback, when we're able to reflect, and when we're able to change our behaviors based on those things, that's what cultural safety looks like. Because just because you're aware of my culture doesn't mean that you're supporting me. Just because you think you're competent in my culture doesn't mean you know what I need. But when you're able to ask me what I need and hear feedback and hear how you're different and what's going on and how I interact in these systems and how I feel in this space, that goes so much further in allowing us to actually support people in the way that they need. All right, next slide. So, in your roles as son mentors, we got a couple of doctors and other providers on here. What do you feel your role is in creating cultural safety in your space? How do you create cultural safety in your role? Latoya said, be humble. Yeah. So maybe we're not making assumptions and feeling like we're always right. Being humble means we're willing to take some feedback. Listening. Yeah. So especially in like a fast-paced environment at a hospital, it's hard to get people to listen to you. And so as sons and as kind of these like, because what you really are as a son is you're a cultural ambassador. You're connecting kind of this system to this person and saying, this is how I'm going to make sure things are being translated back and forth effectively. And so listening to people is definitely the first step to that. Also, we have, one second. So not being judgmental, so not judging people for their behaviors and not using stigmatizing language. That is going to make people not feel safe or comfortable around us. Brian said, see reality through the eyes of our clients. And so we can grow empathy. Absolutely. So when we're able to like think about things from different people's perspectives and hear and reflect on people's perspective without our stigmas and without our judgments, that's what helps us actually empathize and connect with people. Ask questions, be curious about what I don't know. Absolutely, Tambra. So not just assuming, and even more than that, not being scared to ask. I think a lot of the times we feel like we always have to be right because we're in this medical environment. You don't. I am wrong so much. I'm often wrong in the middle of trainings, which is, although it can be uncomfortable, it's important because that's how we learn. That's how we grow. That's how we make sure that we're double checking. I love this piece of being curious. So like wanting to learn. It's like, I want to know about you and I want to know how I can best support you in this environment. Cole said being present. Absolutely. Wendy said asking how we can help. Yep, that non-judgmental. Tiffany said tailoring care to the patient's needs. Absolutely. So not just assuming that we're going to deal with this or assuming that the way that we provide care is best, but specifically asking them, how do you want care? Do you want your lunch before or after you do this medication or this treatment? Do you feel like this is something that's going to work for you? How do you want to be discharged? What do you need before you go? All of those things might not just be a checklist, but they're going to be individualized. Yep, being open to changing our plans, asking questions without getting the expert trap. So without saying, I know everything and you know nothing. So therefore, I'm here to provide care and you're here to have care provided unto you. It's more symbiotic. It's a conversation. We're trying to support people, but people actually know what they need a lot of times. Asking patients to teach me about them, meeting people where they're at, that tried and true adage. So not just saying that you need to come here or you need to be doing this before I'm willing to work with you. Respecting feelings, for sure. Understanding that patients' lifestyle may have been difficult and go into every interaction with an open and eager mind and empathetic heart. That is so sweet, Alicia. So yeah, so people have different lives that are really challenging that might change how they show up in our space. People who might have been harmed or disrespected or abused by people in the medical center, who might have been dealing with a lot of harm in their day-to-day life. And so having us be able to carry that through is really, really important. I like to say when I'm wrong, these are my great counseling skills, which breaks the expert role and usually breaks the ice. Yeah. So be a little funny and just like be willing to be like, yep, I messed that up. Because that makes people know that you're willing to hear that. Because oftentimes you won't really notice it. A lot of times people don't really notice it till you start doing a lot. But a lot of people have a lot of challenge being wrong, especially doctors, if we're being honest. They have a lot of challenge being wrong. It's really different. It's really difficult, especially with malpractice suits and like all these things and like all these really these complicated things that are kind of beat into us in these systems, saying that we always have to be right. And you really don't, but you do have to listen and you do need to support people. And that's the things that we're really prioritizing. Yep, they are the experts of their lives. Yeah, and thank you for saying this, Christine. I'm really trying to find my place in this role. I've been afraid of making mistakes. And that's the thing, it's like, I think it can feel concerning and scary, and like all of those feelings are fine, and we're gonna make them. So we might as well be honest about them and reflect on it and grow. Yep. And then Elvia said, doing what you say you're gonna do. So showing up for your patients. And if you can't, or if something goes wrong, apologize. that's also that thing about lowering that barrier between the expert and patient. It's about saying like, I too mess up sometimes. Sometimes your patients forget appointments and sometimes you forget appointments. And it happens. It's the reality. And like, if we just kind of need to be able to roll with it the best that we can. Yep. And then like leading with empathy, and recognizing we're all human, for sure. Could you hit the next slide, please? It's coming up in my last couple minutes. There it is. So when we talk about cultural humility, the goals that we have, we'll start with the goals and then I'll move into how we do it. So these are the principles and then I'll talk about the tools. So the principles are, we want to generate cultural safety. We want people to be safe and comfortable being themselves in our environment. And we want them to be able to know that we're here to support them. We want to enable mutual empowerment and respect. I want me to feel empowered as well as I want my patients, my clients, my participants to feel empowered as well. And I want us to have a mutual respect. I respect them and I want you to respect me. I respect you as a person who cares about your health. That's why you're here. As a person who wants to feel better, as a person who can navigate their own issues and has a lot of power and resiliency. And I'm a person who has some training and some education and some experiences that I can help you, that I can help with. We want to develop partnerships, connect with people, be connected and partnered with people going through these things, not just like I'm doing the work and you're just there, but we're both doing the work for this. And ultimately, it's about providing the best care. We are trying to provide the best care to people ultimately in our hospitals, in our spaces, because that's how we actually do our jobs. All right, next slide. And back one, I think I might have skipped one. Or did it disappear? Oh no. Can you skip ahead a little bit? And then one more. Oh, one slide got deleted. Oh no. Oh well. I'll come back to that in just a second. Can you go back one slide, please? So what are some barriers that you faced when you're working with clients who are different from you? What are some challenges that come up when you're working with clients that are different from you? Yeah, Brian said, sometimes it makes providers uncomfortable to see their clients struggle, but there's learning in the struggle with change. So yeah, so there's a lot of hard things going on, but like, it's not about taking away people's power or infantilizing them with their struggle. It's about, I am here to support you and figure out how to help. So Jay said using correct pronouns. That's a change. That's an adjustment. That's something that you have to practice and get good at. And it's also really essential to people being respected. Working with trauma is pretty intense. And being able to hold that can be really hard. Dealing with resistance. Usually my thing is, if you're feeling resistance, you're probably not going the right direction. Because you should be working with people. People should be leading their own care. And where we really sit is actually supporting people and making the decisions that work for them. We should not be telling anybody what to do. And that resistance is a lesson for us, saying maybe we're pushing too hard or pushing in the wrong direction. Tambra said, I'm challenged with the language line to make a strong human connection with the patient. Could you say a little bit more about that? You're welcome to unmute, or you can just type it in. Okay.
Thank you. It's so much easier to unmute and do it.
Okay, go for it.
So I noticed when I'm using the language line, it's interesting because I'll hand them the phone and then I won't keep eye contact. I kind of look away and see what's going on. And then, you know, they hand the phone back and then they don't look at me and I'm listening to the interpreter. I don't know if anybody else is challenged by that, but it's really interesting. And I walk away with like feeling like I didn't make that real heart-to-heart connection, if that makes sense.
Yeah, I think that's a great point. So when you're using this third party to communicate, it can be a huge challenge because you feel like you're not talking to the person. And that's an adjustment. Like, I think depending on how much you work with translators, you get more and more, you get more comfortable with it. Something that I like to do is just like when I've had to use language lines is just like putting people on speaker if that's possible, or if I have like my wireless earbuds, I'll give us each an earbud so we can both hear and we can both talk at the same time.
Good idea.
And that also allows us, because I think translators, you kind of hear a person's voice and that's who you want to look at. So I try to envision that it's actually their voice. And it's like, because it's a practice, and like you have to like, and it's kind of awkward, like when they're talking to a phone and you're like waiting to hear what they're actually saying. So like keep eye contact, and it's so easy to go do other stuff. So it can be pretty intense, but I think that like really pushing for it can do, like, I would say practice. I think that's like a moment, like maybe if you have a client where you're like, I really want to connect with this person, really try to keep that eye contact, really try to do it and see how that feels. And then kind of go from there and work with that. But I think that's such a great point. So yeah, thank you for saying that. Yeah, so then we have like developing trust, breaking down those barriers and those language barriers. Tanya said, when they tell you they can function on substances that are only in treatment because they're court ordered. Oof, that's hard. So you're also having this situation where people are coming and seeing you because they have to. I hate that. I love working with people. I think I actually have a real passion for substance use treatment, even like as a harm reductionist. And what I really love about it is when people want to be there and they want to be a part of this, or maybe they don't know and they're talking about it and they're exploring it. But when people have to be there, that's really hard. And I think oftentimes the best way we kind of deal with that is just like opening up that conversation and being like, yeah, like we have this system that like is forcing you to be here. So like, what are your goals? You're in here because you don't want to go to jail. So what do we need to do in order to kind of get you through this process so you can kind of get back to doing what works for you, and figure out what works best for you? And maybe I have my own boundaries, like I can't lie, but what I can do is this is maybe the lowest barrier I can kind of work with, and this is how I can support you through this. Because ultimately that's actually what builds trust. And honestly, like when you're able to actually break that down and say like, the court made you be here and that sucks, so let's talk about it. People oftentimes will build a real connection with you, and that connection can actually lead to much more higher quality care, and even people more willingly coming into treatment because they had a lot of apprehension. But if you're just kind of like, well, yeah, you got to be here, so we're just going to kind of put you through the ringer, it doesn't make them really want to connect. Yeah, understanding differences in the community, how they're stigmatized. People might be afraid to know about their substance use, but tell their family about their substance use because of this. People might be uncomfortable because they're making assumptions about what we feel about it. And so you might, and I like this, what you said, Christine, I don't lead with clinical, I start with lots of listening and then talking with, not at. Yeah, so that's a great way of kind of breaking that down. Awesome. And then just kind of remaining aware of my own biases. When they weren't expecting counseling, they just kind of came to get their thing and go. And you're just like, okay, let's talk. And now they're just kind of like, all right, why am I here? That can definitely be a challenge. And people might be projecting their anger onto you. That can also be a real thing. All right, could you just go forward 2 slides? And go ahead and skip one, because I think we've kind of touched on a lot of these things. All right, and then just kind of got to click through this. All right, and then 2 more. And then 1 more. All right, so when it comes to cultural humility, these are some practices that we can engage in. So number 1, exercising self-reflection and critique. Critique is not bad. Critique is how we learn. So take some time to reflect on your own personal history, your own biases, how you relate to substance use, because the more you become aware of your ideas and assumptions you hold, the easier it is to kind of start breaking those things down. Assumptions about why people are late, assumptions about why people are here in treatment, assumptions about what people think about you, all of those things. We want to recognize the dynamics of power and privilege. Let's understand how those things interact. When people are coming into our care, recognizing that as an expert, as a person with structural power, even if we might not feel like we have that, that can really influence your interactions with clients. I talk a lot about like, yeah, you might feel like you're a son who doesn't have a lot of power in this hospital, but people might look at you and be like, you can get me kicked out of this. You can get me sent back to jail. You can get me coded and force me to stay here. You can 5150 me. There's a lot of structural power that we hold. And so recognize those dynamics and how they influence our conversations and really work to balance out those dynamics so you can have a conversation on an even playing field. And last, be comfortable not knowing. Be comfortable knowing that people are going to have different reactions to you based on their own experiences. And you can kind of balance your expert knowledge around like, what is buprenorphine? What is treatment? With an openness to learn from clients, to learn from their experiences, and to kind of create that feedback loop to that personal reflection and critique, so that you're able to engage with that. And then last, just like practice lifelong learning. Keep on learning, keep on growing, keep on being able to be in your thoughts, giving people choice. That's huge, Christine. All of that allows us to connect with people on a cultural level and create cultural safety, because people know that we are willing to learn and grow, and that we're not just stagnant, and we're not just gonna force them on these same ideals, and that what they say to us actually matters to us. All right, I think maybe that's my last slide, or my next slide is like goodbye. Yeah, I don't have an evaluation for y'all, but you should definitely fill out Sherry's after this. Thanks so much for being here with me. I'll be on for a few more minutes. And also, I'm here to support you. So if you ever have any questions, please email me. Please reach out to Sherry or your Sun mentor. And I can like, if you want to have a conversation about this, any of this, I'm here to support y'all. Please reach out. And thank you. And I'll talk to y'all again soon.
Awesome. You know what? Awesome. As usual, Charles, thank you so much. You are always just have brilliance of words. I love that we're different, you know, depending on our groups, work, family, that truly hit home for me. Thank you. And I'm sure we'll see you again. All right, next up is our last breakout. We're gonna have to cut this short. We're gonna have 5 minutes. You're gonna be in a breakout room with your Sun mentor. And if you don't know who your Sun mentor is, it's okay. Caroline has been working on this. We have some Sun mentors that are not with us today, so we had to make adjustments. But it is just an activity just so we can network, and we'll be only having 5 minutes. Are we ready, Caroline? Okie doke.
Yes, I'll go ahead and open your room. Hey, so y'all have joined on phone numbers, so I'm not sure what group you're with. Can you tell me your name or what hospital you're from?
Have someone on site, but
Hey, everybody, welcome back.
That 5 minutes
It's so
went by
fun seeing
really
everyone's
fast.
faces. I figured, yeah.
Yeah, we got kind of cut off in the end, so I apologize to anyone who didn't get to share.
Yeah, same.
Okay, I got kicked out. Sorry about that, guys. Okay, everybody back, because it just totally kicked me out.
Everybody is back.
Okay. Let me go out. Okay, so thank you for joining us, you guys. We had an action-packed. Sounds were going out a little. We ran out of time. Just wanted to let you know the takeaways are we received strategies today to enhance and support cultural considerations and providing a safe and trusting environment. And we definitely learned some techniques to engage in cultural sensitivity communication, include active listening and providing a safe environment. We also want to make sure that you're signed up with Slack. If you're not signed up, let us know. You could type it in the chat and we will get you added. It's a great way to connect and get resources. And every Thursday, we do have a technical assistance time. Send support 2:30 to 3, or just show up and say hi to us. We get lonely, okay? follow us. You can follow us on all of our social media. It's a great way to stay connected and get some updated information. If you haven't received the Substance Use Navigation Toolkit, you can use the QR code here. You just need to open your camera on your phone and put your camera up to the QR code and a link will come up. So if you want to do that, I'll leave that there for just a second. Otherwise, we'll put it in the chat or you can email me. That's fine. There's plenty of avenues if you can't get the QR code. We've answered questions. If there's more, feel free to type it in the chat. We'll be here for a few minutes. We also want you to complete the evaluation. The link is in the chat. Our next Sun Training 101 series is April 22nd. That's next Thursday. And our next regional meeting is June 17th. So those are our upcoming trainings. Please, we'd love to see you there. This is our Sun Mentor team and the regions. Again, if you don't know your region, it's so quite okay. We just send an email to sun@californiabridge.org and we will pair you with your Sun Mentor. And this is just a list of each region and their contact information. Okay. And again, we're always here to help. Stay safe. And this is my contact information. I'm Sherry Cisneros, the Substance Use Navigator and Director for the California Bridge. And again, we'll be here for a few more minutes. If you have any questions, please let us know. Thank you for joining us today. Bye-bye.